and record. And first, just wanted to share some information regarding a RAC card that is available to order, which has information about all of these programs and contact information and how to refer to the programs. Again, this will be in the slide deck you'll receive. There is a link for the website to order these, and then the number for the stock. And then also just putting in a plug for the Chronic Disease Partners meeting, which will be held in October on October 12th, 14th, 19th, and 21st. If you haven't registered, I encourage you to do so. We have some great speakers lined up focusing on community engagement and health equity and changing times, innovation in changing times. So encourage you to do that. So I'm going to turn it over to our first speaker, Kayla McGee, and we'll just go from speaker to speaker. I think you all know your order, and I will advance the slides.
Thank you, Brooke. As Brooke said, my name is Kayla McGee. I'm the Diabetes Program Coordinator, and I'm going to talk to you about the Diabetes Prevention Program and Diabetes Self-Management Education Programs. Next slide, please. It is said that 1 in 3 Americans has prediabetes, but most people aren't aware of their risk, and a possible diagnosis of prediabetes isn't very often given. To bring more awareness of this risk, there is the Undo the Risk campaign. This campaign was launched in September of 2019, and it has comical situations that you can't undo, but you can undo your risk for diabetes. To know if you're at risk, you can visit the website www.undothe-risk.com to take the risk test. After individuals get their risk score or results, they can share their risk with their provider, and then also talk about how to make lifestyle changes or even get their blood sugar tested to see where they're at on the scale of developing diabetes. On the slide, you'll also see some of those risk factors that the risk test would assess. Next slide, please. So talking a little more about the National DPP, this is the program that the CDC supports. It's evidence-based lifestyle change program developed specifically to prevent type 2 diabetes. It is designed specifically for people who have prediabetes or are at risk for developing type 2 diabetes. It's a year-long class delivered by a trained lifestyle coach who helps participants focus on long-term changes and lasting results. Participants can expect to benefit by losing 5 to 7% of their body weight, learning to incorporate 115 minutes of weekly physical activity into a busy schedule, and also learning how to eat healthier. The class is delivered in a classroom setting with peer support, giving participants the team of friends and neighbors to share in struggles and victories. And the research and evidence-based program has been shown to reduce the risk of developing type 2 diabetes by 58%. To qualify for the program, individuals need to be at least 18 years old, overweight, cannot be pregnant, and cannot have a diagnosis of type 1 or type 2 diabetes yet. They must also have one of these qualifying indicators, either a blood test showing prediabetes, maybe having a previous diagnosis of gestational diabetes, or a high score on the prediabetes risk test, which was available on the website. Programs are available across the state. If you want to see if there's a local program, you can go to undothe-risk.com/find-a-program to see what's available in your area. I will say though, many of the programs have switched to virtual options. So if your healthcare facility doesn't have one there, maybe a coordinating healthcare facility might have one that you can utilize. Next slide, please. This is another map that kind of shows where some of these programs are, but this map also shows the need for National DPP. So we looked at things within the community that cause the need for the diabetes prevention program to be higher, whether it be access to healthcare, higher risk of obesity, higher rates of diabetes, and the darker the color, the higher the risk. Next slide. For those that have already developed type 1 or type 2 diabetes, there is a specialized education available to them. It's called Diabetes Self-Management Education and Support Services. This will teach them it will provide information and skills for people to best manage their diabetes. Diabetes self-management education is tailored to patients' individual needs, goals, and life experiences, and is guided on evidence-based standards. Patients learn to eat healthier, be physically active, monitor blood sugar levels, take medication, problem solve, reduce risk for other health conditions, cope with the emotional side of diabetes, and just improve their health and quality of life. Diabetes self-management education is led by trained diabetes educators like a registered nurse or registered dietitian, or even a mid-level provider or pharmacist. It's important for patients to receive diabetes self-management education services when they're very first diagnosed, but there are also other times where it's helpful to help best manage their diabetes, maybe at a yearly follow-up visit, if health complications arise, or maybe when there's changes in care. Most programs are able to adapt to virtual care during COVID. So even if the individual lives in that area, they can still access the services online. But you should check with your healthcare system to see what DSMES services are available and how to refer to them. If you don't know, we do have a map. If you go to the next slide, that's on our South Dakota Diabetes Coalition website. Here, individuals can select the area and see what services are available in that area. Next slide. If you have any questions about these programs or would like just more information in general, feel free to email me. My contact information is right there. All right, I will stop and the next person can go.
Hello, my name is Ben. I'm the Community Outreach Coordinator for the Community Health Worker Collaborative of South Dakota, and I wanted to provide a quick overview of community health workers, as well as the Community Health Worker Collaborative. So if we move on to the next slide, and then the next slide as well, what is a community health worker? The Community Health Worker Collaborative of South Dakota, as well as the South Dakota Department of Health, have adopted the American Public Health Association's definition of a community health worker. And that definition is a CHW is a frontline public health worker who is a trusted member of and or has an unusually close understanding of the community served. And this trusting relationship enables the worker to serve as a liaison or a link or an intermediary between health and or social services and the community to facilitate access to services and improve the quality and cultural competence of service delivery. So continuing on to our next slide here, the community health worker scope of work in South Dakota is threefold. The first is health system navigation and resource coordination. The second is health promotion and coaching. And the third is health education to teach or promote methods and measures that have been proven effective in avoiding illness and or lessening its effects. So moving on to our next slide here. Here in South Dakota, we do have CHW reimbursement for community health workers. So this just is a quick summary of what reimbursement looks like. I would invite you to view our chwsd.org website for more information, but the requirements for Medicaid reimbursement are that services must be provider ordered. The patient must have a qualifying condition and or a qualifying barrier. Those are all listed in the billing and policy manual for CHWs. And then the individual CHW must be employed and supervised by an enrolled CHW agency. And those agencies must provide some additional information prior to becoming an approved agency. And then the big piece of the reimbursement puzzle here is that the CHWs must have completed an approved training program. So the billing and policy manual includes all of the complete information regarding reimbursement through South Dakota Medicaid for CHWs. So moving on to the next slide here, as far as training programs here in South Dakota, we do have a few training programs that are approved. Lake Area Technical College in South Dakota has a certificate program, as does Minnesota West Community and Technical College and Northwest Technical College. Those two are located in Minnesota. And then the Indian Health Service Community Health Representative Training Program is grandparented in as a training program. We also have Southeast Technical College in South Dakota that will be offering a CHW certificate starting next fall. And then there's also the opportunity for training programs from other states to be reviewed on a case-by-case basis. And this is especially helpful if somebody were to train in a different state and then move to South Dakota and want to continue working as a CHW. So jumping on to the next slide here, there are additional training programs as well. There's specified training programs. And so how these programs work, programs such as National Diabetes Prevention Program or Better Choices, Better Health, is that a CHW can train in these programs to expand the services they're able to provide, especially in that group setting. or individuals who have trained to lead these programs. For example, a dietitian trained as a lifestyle coach for the national DPP could be reimbursed as providing a service of the CHW scope of work using the appropriate CPT code for reimbursement. So that dietitian wouldn't be able to work under the full scope of work as a CHW, but they would be able to be reimbursed as they're providing a service of the scope of work. So visit chwsd.org/training for more information on training programs available here in South Dakota and how those specified training programs can expand the services CHWs can provide in South Dakota. Continuing on to the next slide here, the Community Health Worker Collaborative of South Dakota was established in January of 2020 to promote, support, and sustain the CHW profession in South Dakota. And the CHWSD is an extension of the South Dakota Department of Health, Office of Chronic Disease Prevention and Health Promotion. Moving on to the next slide here, I just wanted to share briefly our South Dakota specific CHW planning and assessment toolkit. It's a 4-module toolkit that provides a really great overview of how to start a CHW program and what all a CHW program entails. And it's tailored specifically to South Dakota. There's both a self-guided resource version as well as a CEU version. The CEU version is the exact same content. You just need to go through it from start to finish to receive those 2 free CEUs. And there's many different CEUs for many different disciplines. So moving on to the next page here, there's 4 modules. The first looks at the CHW background. The second looks at CHW planning. The third looks at implementation of a CHW program. And it wraps up with module 4, looking at evaluation and sustainability. So moving on here as well, I just wanted to share a little bit of a funding opportunity that's just around the corner here, and that's funding through a national initiative to address COVID-19 health disparities that South Dakota received. There's 4 grant strategies, but South Dakota is primarily focused on strategies 3 and 4. And CHW work specifically falls under strategy 3 to build, leverage, and expand infrastructure support for COVID-19 prevention and control among populations that are at higher risk and underserved. And this strategy specifically calls out to build and expand an inclusive public health workforce, including hiring people from the community, such as community health workers. So if we jump to the next slide here, we can see that we have been able to utilize this grant funding to support a lot of different initiatives here in South Dakota. We are able to fund health systems with resources to promote the CHW workforce and to establish CHW positions, as well as hospitals, clinics, and other healthcare related organizations. We'll also be working with community-based organizations, federally qualified healthcare centers, dental programs, and then also investing more into the training programs here in South Dakota to ensure that they have the supports necessary to support an expanded enrollment of students into the CHW certificate. We're working with South Dakota HealthLink and the Helpline Center to support the closed loop referral process, and then really working to expand the supports that the Community Health Worker Collaborative of South Dakota can offer. So one of those specific supports I wanted to quickly address today was the opportunity for funding to fund a CHW program within your organization. So this funding will launch here in September, and it will be able to provide up to $50,000 to develop a clinical or healthcare-based CHW program, a community-based CHW program, or a career lattice, also known as cross-trained CHW program. So stay tuned for more information about that funding opportunity coming soon. And then I just wanted to share my contact information. I know it was a super quick presentation here, so feel free to call, email, and check out our website as well for more information.
Hey, hi everyone. My name is Megan Jacobson, and today my colleague Nikki Prosh and I will be talking about the Better Choices, Better Health South Dakota programs that are offered through SDSU Extension. And these include the suite of chronic disease self-management education workshops, Fit and Strong, and Walk with Ease. Next slide. So I'll start by introducing chronic disease self-management education, or CDSME. It was developed in the early 1990s by Stanford University to provide self-management skills and confidence to people with one or more chronic conditions. including physical and mental health disorders. So the rationale for its development was that most people over the age of 40 have comorbid conditions, and that the skills needed to self-manage these conditions are similar. CDSME is evidence-based and has been studied in a variety of settings, populations, and among participants with a variety of chronic conditions. CDSME is delivered as small group workshops for adults living with chronic health conditions and also their caregivers. And workshop sessions are highly interactive and focus on problems that are common to individuals dealing with any chronic health condition. And topics include pain management, nutrition, exercise, medication use, emotions, and communicating with doctors. Workshops are facilitated by 2 trained lay leaders, at least one of whom has a chronic disease themselves. And each workshop contains 15 hours of content that is covered during weekly sessions held over a 6-week period. Next slide. So the suite of CDSME workshops known locally as Better Choices, Better Health South Dakota are licensed by SDSU Extension and are offered statewide at no cost to participants. So the Better Choices, Better Health suite of CDSME workshops currently include those for chronic disease, diabetes, chronic pain, cancer, worksite chronic disease, which is a workshop offered as shorter sessions that can be implemented during a workday. And we also have a program called Tomando Control de su Salud, which is the chronic disease workshop conducted in Spanish and features culturally appropriate activities and subject matter. The delivery formats for these workshops include in-person, virtual, and a self-guided toolkit with weekly leader calls. And since COVID, we adapted to bring on those 2 distance learning formats. So we have been able to offer completely statewide since 2020. So there are approximately 50 active lay leaders trained to facilitate Better Choices, Better Health South Dakota CDSME workshops. And since 2014, when Better Choices, Better Health CDSME was brought to South Dakota, lay leaders have facilitated over 200 workshops with more than 2,000 participants attending. And self-reported data collected from participants during workshops show that the average age of people coming to workshops is anywhere between 60 to 75 years old. 31% of our participants are caregivers. 62% report having multiple chronic conditions. And the most common chronic conditions participants report are hypertension, arthritis, diabetes, depression, chronic pain, and obesity. Next slide.
And I'm going to transition us a little, talking more specifically about the 2 physical activity programs that are offered within the suite of Better Choices, Better Health programming. So next slide. The first one I'm going to talk about is our Fit and Strong program. So Fit and Strong is also a program that is licensed by SDSU Extension and is offered across the state at no cost for any of the participants. It is a program that's recognized as an evidence-based fall prevention program by the Administration for Community Living. In addition, workshop structure kind of looks like all workshops are offered over the course of 8 or 12 weeks. Each workshop within that session is an hour and a half and includes 60 minutes of exercise and 30 minutes of group discussion around a specific health education topic. The exercise component, so those first 60 minutes of the workshop, include some flexibility, aerobic exercise, strength training that focuses on lower extremities for the participants, and participants use an adjustable ankle weight. As you can kind of see in those images, the blue thing down below their ankles is an actual picture of the ankle weights that we used, and they are adjustable. And workshops also include balance exercises throughout the session. We don't do a specific balance section within the workshops, but it's included within some of the strength training and step aerobics that we do throughout the 1.5 hour session. So workshops are designed for individuals with arthritis, but individuals without arthritis can also have success in the programs. The health education topics that are discussed might gear a little more towards that arthritic type population and what we discuss in kind of the health education component. For Fit and Strong, we have about 32 trained leaders, both within South Dakota, and we have some trained leaders in North Dakota. And our workshops also are offered either via Zoom or in person across the state. Next slide. And the other program we have that's specific to physical activity is our Walk with Ease program. So the Arthritis Foundation developed the Walk with Ease program, and it is a community-based physical activity self-management program. SDSU Extension oversees the program throughout the state by managing a database of leaders and planning and implementing workshops across the state. Walk with Ease is offered over the course of 6 weeks, with each session for the in-person workshops lasting 1 hour. The main focus of Walk with Ease is really around walking, as you probably could guess. However, it is a multi-component program that includes health education, stretching, strengthening exercises, and motivational strategies are included throughout the workshop. It was, again, this program too was specifically developed for individuals, specifically adults with arthritis who want to be more physically active. However, it is also appropriate for people without arthritis, individuals with diabetes, heart disease, or other chronic conditions, and overall individuals who want to get more active can find success. The only prerequisite to being participant in Walk with Ease is that they can be at least on their feet for 10 minutes without increased pain, and that can be with the use of supportive devices like a cane or walker. For Walk with Ease, we have about 20 trained Walk with Ease leaders across the state, and workshops are offered in a variety of locations. In addition to the workshops Megan discussed in Fit and Strong, Walk with Ease also is offered in a virtual platform where participants go about the walking in a self-guided format, and they can also join a weekly Zoom session, or we also have our in-person workshops offered across the state based on location of our leaders. Next slide. So all the programs that Megan discussed in Fit and Strong and Walk with Ease are open to the public for registration. We can also work directly with organizations to directly implement a process for provider referrals. Within our extension program, we have 2 South Dakota referral coordinators that really help manage the toll-free number that's listed on this side, and also manage our online registration portal for all of our programs, as we just discussed. Those referral coordinators can help participants find a program that best fits their needs. So if they're unsure of what they maybe are looking for, if they call that 188 number, we can help kind of screen and refer specific programs that we have available to help get them enrolled in the one that might be most appropriate for them. But you can kind of look through this slide here of the additional ways for referrals. Next slide. This map here really is just demonstrating where we've had participants by county across South Dakota. So it shows the 3 different delivery formats for our program. So distance learning, in person, and both is where we've had participants from both type of delivery formats. Through adaptations that we had to make in 2020, we now are able to offer all of our programs within the BCBH suite of programs in a distance learning format. So this has really worked in our benefit, because now if providers are looking to refer, it's an easier way to refer. If there's not a local level trained leader, they can be referred to some of our virtual or distance learning opportunities. So it really has helped with us reach some of maybe our areas we haven't served as much over the last few years, and increase those opportunities for those referrals to all of our programs. Next slide.
Okay, so we're going to wrap up today just discussing some ways that you can help bring Better Choices, Better Health South Dakota programming to your community or organization. So listed here on this slide are a few of the things that we'll mention. And one is working with our referral coordinator, Vicki Palmreiter, to implement a referral model, a referral policy. And we do have a model policy for referrals that we have developed as part of the South Dakota Department of Health model policy. And so it's on the Good and Healthy page. and you can access it by searching for it, or Nikki did drop a link that can direct you right to that model policy. And Vicki is one of our referral coordinators who works exclusively with healthcare organizations. And she has had some really great success in helping organizations integrate referrals into the EMR, and also connecting patients with information through the patient portal messaging. So if that's something that you would like more information on, please see Vicki's contact information on this slide, or you can always reach out to me and I will introduce you to Vicki. Also, as you heard Ben Tinsvold mention earlier, the community health workers in South Dakota will be trained as Better Choices, Better Health CDSME lay leaders and have that option to do so under their scope of work. So connecting with these positions within your organization and community will be really important to helping advance CDSME here in South Dakota. Lastly, for employers specifically, hosting a worksite workshop and offering employee incentives for completing a workshop is another great way to work with us and Better Choices, Better Health to provide health and physical activity opportunities for your employees. And you can reach out to us. We have worked with some employer organizations so far on some ways that it can be implemented to best fit the needs of your organization and what you have in place as far as health and wellness programs already. Okay, so next slide. So thank you today for your attention, and we really look forward to connecting with you about Better Choices, Better Health. So please don't hesitate to reach out to either myself or Nikki. Thank you.
Good afternoon. My name is Rachel Sayre, and I'm the Heart Disease and Stroke Prevention Coordinator with the South Dakota Department of Health. I'm going to touch briefly on one of the initiatives I've been leading around self-measured blood pressure monitoring. Go ahead and switch slides. Currently, my program is partnering with 6 clinics, 1 fitness and recreation center, and 1 pharmacy network, which comprises about 7 participating locations. There are also 4 additional sites going through the application process right now to receive funding and partnership. Each site runs their program a little bit differently, but they all follow the same general concept. To give you a quick overview of the general process, we start by first identifying an individual who would benefit from enrolling in SMBP, meaning self-measured blood pressure monitoring. There are several different ways these folks are identified. Most of the time it's because they come into the clinic and when their vitals are taken, they have an elevated blood pressure. And once the potential participant is identified, the facility goes through the process of explaining the program, providing them some education, and then getting them enrolled. After they've enrolled, the participants take an automated blood pressure cuff home with them, and they're going to check their blood pressure twice a day for typically 2 weeks. During that time, they're going to communicate back and forth with their care team if any concerns arise. Otherwise, they come back for a follow-up appointment in usually 2 weeks. At that point, the provider is going to discuss their home monitoring blood pressures, if they look okay at home, or if they're going to have to monitor their blood pressures a little bit longer, and maybe if they have to add or adjust any blood pressure medication or implement any other lifestyle modification recommendations at that time. Then this process continues until the participant reaches a point where their provider feels their blood pressure is considered controlled. And typically that means consistent readings below 140/90 per our performance measure standards, but ideally we would want them to be below 130/80. Our rec center in Mitchell varies a little bit here as they're not clinically based. So for them, any adult can enroll in their program, and then the rec center staff works with their provider to communicate back and forth. The rec center has incorporated an exercise component into their program. So participants monitor their blood pressure for a week, then they participate in some personal training sessions, and then they monitor their blood pressure again after that. They don't have the ongoing monitoring like some of the clinics do, but instead the rec center works with the participant providers to make sure that they're following up in the clinic if they need to. And then additionally, our pharmacy program is a little bit different in that it is a 6 to 8 month long program. These individuals continue ongoing monitor until they're stabilized at their goal for at least 4 weeks. The rest of the process is pretty much the same. They just have a few additional services that the pharmacies incorporate, like regular health coaching sessions. Go ahead and switch slides. There are several goals for clinics implementing SMBP programs. This is a great way to address NQF18, which is the blood pressure control performance measure. Our clinics have a goal of maintaining at least 80% control in their populations with hypertension. Unfortunately, our national data shows us that most facilities are only at about 40 to 50% control rate. So most facilities have a ways to go to meet that 80% goal. This program allows us to really dive into their blood pressure data and make sure that the electronic medical record is capturing the data correctly and that their performance measures are accurately reflecting the clinic's actual control rates. In addition to addressing blood pressure control, this is also a really excellent way to determine whether an individual has true hypertension or whether it's clinically induced, known as white coat hypertension or white coat syndrome. This ensures that we're not treating patients for a disease state they don't actually have, preventing undue harm from unnecessary medication. On the participant side of things, there are also a lot of benefits to SMBP. As I just mentioned, this serves as a really great tool to help with diagnosing high blood pressure, and it ensures the patients aren't being over-treated for a misdiagnosed condition. It's also a great way to ensure that they're receiving enough medication therapy. Sometimes a blood pressure reading might be fine in the clinic, but then when they monitor it regularly at home, we find out that it's still elevated. And by giving providers a consistent view of blood pressure readings over time, they're really able to make a much better decision-making for each person and make sure that they're receiving adequate and appropriate treatment. And this also helps decrease the amount of time it takes to find the right treatment plan, since there aren't going to be those long gaps of time in between follow-up. Go ahead and switch slides. And I just wanted to share with you some results from our last project period, which started back in July of last year and ran through June of 2021. As I mentioned, each location runs their program a little bit differently, and they all started at different times during our project period. Additionally, our COVID obviously had dramatically reduced some of the numbers of participants we were seeing in comparison with what we were anticipating based on the previous year. However, we still had over 250 participants in our SMBP programs. Of that, 162 had completed the program by the time our data was collected. There were still quite a few participants monitoring their blood pressure into July, and those numbers didn't count toward the completion data that you see on the slide here. Out of those completing the program, 56 were identified having controlled blood pressure.
I just get hot about it
Potentially,
because people died.
could you please mute your line, Barbara and Norquist?
Any deaths that happen is because of the
Hello, if everyone can mute their lines,
Yeah.
that would be great.
Bam, bam, here it is.
Oh, thank you. Elvis and Bam Bam were the Flintstones.
Bam, bam for,
Please mute your lines.
it's called Bam Land.
Out of those completing the program, 56 were identified as having controlled blood pressure, meaning that these are people who could potentially have been misdiagnosed as having hypertension when in fact they really had white coat syndrome or white coat hypertension. These individuals could have been overprescribed antihypertensive if it wasn't for this program. And lastly, 151 different medication changes and interventions were implemented for our participants. Next slide, please. To close out today, I wanted to make you aware that there is an ongoing funding opportunity for SMBP implementation. Facilities can receive up to $20,000, with up to $2,500 of that going toward the purchase of blood pressure cuffs to be used in a loaner program. I'd encourage you to review the funding criteria and apply if you think it would be a good fit for your facility. Additionally, if there are any exclusions or criteria you don't think you can work with, please just give me a call and we can talk through it to see if maybe a modified program might work. Switch slides. With that, thanks for listening this afternoon. And if you have any questions around funding or any other heart disease or stroke prevention initiatives, please feel free to reach out. Thank you.
Good afternoon, morning, depending on where you are. My name is Liz Marceau. I'm the Healthy Communities Coordinator with the South Dakota Department of Health. My time's kind of split between different programs, but today I'll be focusing on the work I do with Rachel in the heart disease and stroke program with the Cardiac Ready Communities. So a little bit of background here, and I caught a typo already this morning when I was going over my slides, but as you know, in a cardiac emergency, really every second that passes without intervention could be the difference of life and death. And in our rural state, it can take an ambulance up to 30 minutes to reach that emergency. So the Cardiac Ready Community Program helps to educate and equip and empower those local smaller communities to be prepared and more confident in helping until more help arrives via ambulance or whatever it might be. With this opportunity, there is no funding tied to it. So it really has to be from a community who is really willing to put in the work and really wants this for their community, wants to work towards this status. So next slide. This infographic shows the areas of impact within a cardiac event. And the first three that are highlighted there of the 5 areas are where a community and its members can have the most impact on survival. And these are the areas that the Cardiac Ready Community Program addresses within its designation status application. So these would be recognizing that there's an event and calling for emergency response, administering CPR, as well as defibrillation. That word never comes out quite right. Next slide, please. There are 9 focus areas within the CRC application, and I'll just kind of briefly touch on each of those. The first being community leadership. So having that one person that's kind of willing to lead the team, and then pulling together a whole team of people, community members, or those that can speak on behalf of the community to pull together the designation application. And then creating an awareness campaign. So this ensures that the community is aware that that their community is working on this project, as well as making sure the members of the community are aware of their risk factors for cardiac events. The community blood pressure control program is, of course, high blood pressure is the leading risk factor for cardiac events. So these communities are required to hold those screening events for designation as well. CPR and AED training. The community is required to report on who is trained within the community, including any of the public, businesses, police, or fire department folks. Next slide, please. Public access AED locations. So victims receiving an AED shock within 5 minutes, 3 to 5 minutes, have a higher chance of survival. And so the program assesses the AED locations and reports them to dispatching so that in an emergency, those can easily be found. EMS dispatching program is another, is the 6th of the 9 focus areas. Having trained CPR trained dispatchers helps the chance of survival, being able to kind of walk people through it while they're on the phone, and then also having those dispatchers know where the AEDs can be found within the community. EMS services, so having those well-trained EMS is critical for those out-of-hospital events. The hospital services, so the program ensures that all hospitals are trained in high quality CPR and are using, that data for improvement. And then lastly, the ninth area is program evaluation and sustainability. So this is making sure that that they are in kind of constant evaluation of where their program is at, if anything drops off, or if they add anything, to plan for the future of the cardiac ready community designation. Next slide. These are just some resources out on the Heart Disease and Stroke Prevention page of the Department of Health website. There's a program guide that's pretty lengthy. There's a media toolkit that has some videos of actual community members. And then there is a webinar too that goes through kind of that program guide and all the steps incorporated in that. Next slide. And then I just wanted to touch on our shining star within the CRC program, which is Kimball. Kimball, you can see where it lies on that little red dot on the map there. It has, their EMS is made up of volunteers entirely, and it's very rural. So they really felt the need to prepare their community for emergency events. After farming, hunting is their main source of revenue. So these lodges are located even further away from access to care, usually with middle-aged people engaging in exercise that they might not be accustomed to. So there's 5 hunting lodges in particular that have purchased AEDs on their own dollar, and 2 of those also have AEDs in their buses that transport hunters out to fields, and so they have them on hand if they are actually out hunting in the fields. So next slide, please. And this is just some pictures of August 11th is when they achieved their designation. And you can see the group of people there. That was most of them. There were a couple other members of their team that couldn't make it, but their team consisted of city council, the ambulance lead, a business who happened to be the grocery store owner, a nurse who also is a hunting lodge owner, newspaper editor, fire chief. So they had a good group of people who knew their community well. And then there's just some pictures of them installing their CRC sign. And that is something that Department of Health does provide to them once they have achieved that designation. We do have one other community, DeSmit, working on their designation. And then the criteria is pretty tough to achieve. And so, it has to take a whole community. So we are looking into the possibility of doing cardiac ready college or cardiac ready company to have some other people have opportunity to participate in the program on a different scale. So that brings me to the end of my topic.
Thanks, Liz. Hi, everyone. I am Rochelle Rossman, and I'm the statewide tobacco cessation coordinator, and I work with Black Hills Special Services. So I'm here today, obviously, to talk about the South Dakota Quit Line and how to make referrals to our program. Next slide, please. Before we dive in, I just always like to note that the term tobacco refers to commercially produced tobacco products only and never the traditional tobacco of our Northern Plains American Indians. Next slide. So just a very basic overview of the South Dakota Quit Line. This is basically our information. So our phone number there is 1-866-SD-QUITS. And I actually spell the number out because I realize now, or put the numbers of the number out now, because I realize not everyone knows how to do that, especially with cell phones changing the game on that. So phone number there, then we have our website, which is sdquitline.com. And the South Dakota Quit Line offers a variety of services. So some of the services include free cessation counseling, and participants can receive up to 12 coaching calls with a trained coach. And then in addition to that, if they are participating in our phone coaching program, they are also eligible to receive free nicotine replacement therapy, which includes a patch, gum, or lozenge product, or they can also get a doctor's prescription for our generic Zyban or generic Chantix. And the participants who do receive those medications or NRTs can receive up to 12 weeks of those products, again, as long as they're participating in the coaching session. Another program or service that we have available is what we refer to as our Kickstart Kit. So the best way I describe this program is it's basically our self-help options. So someone who maybe doesn't want to pick up the phone and call and talk to anyone, they can receive a self-help quick Kickstart Kit at home, which includes 2 weeks, and then they are eligible to receive an additional 2 weeks, so a total of 4 weeks of NRT products along with a quick guide. And the options for enrollment are to enroll through the phone by calling the phone number listed at the top. They can enroll visiting our website and completing the web enrollment form, or they can get enrolled through the fax or EHR method, which I'll talk about shortly. Next slide, please. So eligibility for the South Dakota Quit Line is pretty straightforward. To be eligible, you must be a South Dakota resident and a tobacco user. And that does include e-cigarette users, which we always want to make sure that we're pointing out now, just because we know that that's a really large growing population of our tobacco users. And then the person must be 13 years of age or older. Another thing we really want to point out is that age requirement, just because we do know that people do start using these products, especially e-cigarettes. It feels like younger and younger each day. So we want to make sure that people know that 13 years of age or older are eligible to use the Quit Line. And then the individual has to be ready to quit or have quit in the past 30 days. And then it's always a good reminder to folks just to let them know that we are well aware of the fact that it often takes multiple times to have that successful quit. And so knowing that, we do have the option for people to re-enroll in the Quit Line services twice per rolling 12-month calendar period. Next slide, please. So as far as making referrals to the South Dakota Quit Line goes, whether you're a healthcare provider or just a concerned friend or family member, or maybe you have a colleague you've been talking to, I think we can all probably think of someone in our lives who we know that uses tobacco and maybe is interested in quitting. So all of us can be that first line of defense to help get them to the Quit Line. And that would be more of like a passive referral, having the conversation, maybe giving someone a brochure or a business card, encouraging them to call the Quit Line when you're with them, something as simple as that, or just encouraging that individual to visit the website where they can then fill out the enrollment form on their own, and then the Quit Line will call that individual back. Next slide, please. What we refer to as direct referrals are those referrals coming straight from the healthcare provider. So this is our #1 source of referrals to the Quit Line. And it's also our fastest and most successful way to connect patients to the Quit Line services. So this can be done through the fax referral form, which can be found on our website. We can also have people utilize the EHR or e-referral method. So if that's set up within the health system's EHR, they click that the person is interested in receiving a referral to the Quit Line. And when the Quit Line either receives that e-referral or the fax referral, then the Quit Line will contact that patient. As far as the EHR, the e-referral goes, that is the only way that the Quit Line can provide feedback I should say the direct referral. So both the e-referral and the fax referral are the only ways that the Quit Line can provide feedback directly to the healthcare provider as to whether the patient enrolled or not. And then lastly, I just wanted to highlight another option that we have for training. I know this was a very quick and high level overview of our services and how to make those referrals. Sorry, Brooke, next slide. Forgot to put you forward. There we go. But if you are interested in getting more information on the South Dakota Quit Line, I am available for presentations or conversations. We also have what we refer to as PROF, which is a free online training program that's designed to educate about the Quit Line and help your patients on their journey to becoming tobacco free. And what's nice about this training, again, it's free, but it can be also done at your own pace. So we're actually working to update it a little bit right now. So a couple of things might be changing, but mostly data and eligibility and service options will be changing. Next slide, please. If you are interested in having any of the South Dakota Quit Line resources on hand at your office, we have a lot of resources available for free. at this website listed at the top of this slide. And it's anything from quitline to third-hand smoke, second-hand smoke. We have spit tobacco information, vaping information, basically everything you can think of. So feel free to visit that website and you can order them directly to your office. Otherwise, if you aren't sure how to do that, you can also contact me and I'll help get an order placed for you. Next slide, please. And then listed here on this slide is just my contact information. So again, available for presentations or conversations. If you have any questions, just please let me know and you'll find my contact information here. Thank you.
Hello, I'm Stacy Siegfried and I'm with the All Women Count program. And I'm here today to talk to you about All Women Count. Can I get the next slide, please? So what is All Women Count? All Women Count, I tend to say it too quickly and it comes out funny, is South Dakota's program designed to help women get their needed breast and cervical cancer screenings. Next slide, please. This program only has 2 requirements for eligibility. The first is the age of the woman. South Dakota women must be between the ages of 30 and 64 to qualify for cervical cancer screenings. At age 40, they also become eligible for an annual mammogram. The other requirement for eligibility is income. In order to qualify for All Women Count, the patient's household income cannot exceed 200% of the federal poverty level. Next slide, please. So for 2021, that translates to just shy of $500 per week for a woman living alone. If she has a child, that number jumps to about $670 a week. If she has anyone else in her household that has an income, then that income also needs to be figured in, but that person also figures into the family size. Next slide, please. All Women Count covers office visits for women starting at age 30. Starting at this age, she's eligible for a pap test every 3 years, or an HPV test or a pap HPV co-test every 5 years. At age 40, she also becomes eligible for an annual screening mammogram. However, please note that if you have a patient with an abnormal clinical breast exam or with a first-degree relative with breast cancer diagnosis, that we may be able to make an exception for them. But we do need you to call us and request first. In addition, we also cover cervical biopsies, colposcopies, cone biopsies, LEEP procedures. We also cover diagnostic mammograms, breast ultrasounds, and breast biopsies. While we want to be as helpful as possible, there are a few things we don't cover. The big one is the diagnostic breast MRI. We would love to cover those, but we just can't afford to. We also don't cover any service that isn't directly related to diagnosing breast or cervical cancer. So that means we don't cover genetic testing or STD testing. We don't cover pregnancy tests or x-rays, etc. We also don't cover labs that aren't part of the breast or cervical cancer screening. So if you have a patient who comes in for their annual checkup with this office visit, it's important to be aware that any cholesterol checks, A1Cs, or other blood tests are going to be covered by this program. That's going to be something you can work out independently. All Women Count only works with the help of participating clinics. We need you to let your patients know this resource is available to them and to help them enroll. Please feel free to give us a call if you have any questions or if you would like any additional training for your staff. Thank you.
Good afternoon, everyone. I'm Corey Jacobson, and I am one of the oral health coordinators and a dental hygienist with Delta Dental of South Dakota Foundation. Today, I am here to talk to you a little bit about our Partners for Prevention program. Next slide, please. Do you know the #1 chronic childhood disease? I can tell you that it's not asthma, it's not obesity, and it is not diabetes. It is early childhood caries. It was once referenced as baby bottle rot. There are a variety of factors associated with the disease, such as dental care, dietary habits, and exposure to fluoride, just to name a few. The good news is that ECC is preventable. And the earlier that prevention therapy are introduced, the greater the chance that the child doesn't have to experience the disease in the first place. Medical providers see a child on average 12 times in the first 3 years of life, offering a great opportunity to integrate oral health and to help prevent ECC from occurring. The American Academy of Pediatrics, the American Academy of Pediatric Dentistry, as well as the U.S. Preventive Services Task Force all recommend that non-dental providers integrate oral health into the well-child visit and apply a fluoride varnish. Next slide, please. Partners for Prevention traditionally has been done as an in-person lunch and learn training. The training aims to make the medical provider feel more comfortable about what they are looking for in the mouth to identify if the patient may have some dental cavities going on, to help identify risk factors that increase the likelihood of dental caries, and as well as a hands-on fluoride varnish application. So providers understand how quickly it can be applied to the teeth, as well as giving the provider some experience of knowing what it feels like on their teeth, so that they know what the child is experiencing on the taste and the feel in their mouth. Next slide, please. Fluoride varnish prevents approximately 37% of decay in primary teeth, and it remineralizes active decay. It is not swallowed by young patients, and children can eat and drink right after it's applied. It only takes seconds to apply to the teeth, and it doesn't have to be a doctor or a PA that applies it. It can be anybody that's been trained on the application, so it could be a medical or assistant or a nurse as well. Next slide, please. The training is geared for anyone that works in the medical office, from receptionists to the doctors. A common question is how to integrate the service into a well-child visit. And the training includes discussions on workflow and how to integrate the fluoride varnish into a well-child visit. We also discuss billing and coding of the fluoride varnish from a medical aspect. Our mission is to have fluoride varnishes as a standard of care in all well-child visits. Next slide. If you have any further questions or you'd like to schedule a training, this is my information. And also, if right now, if your facility is not up to having in-person trainings, we can also accommodate to have a virtual training for this. So thank you.
Thanks to the presenters for that wealth of information. We will open it up now. If you have a question, you will need to unmute yourself and then state which presenter you have a question for. I will say that Kayla and Ben, the first two presenters, are no longer on the webinar. They had another meeting they needed to attend. But again, if you'd like to ask a question, we'll open it up right now. You could also type it in the chat if you are too shy to unmute yourself and ask the question.
I did have a question for All Women Count. Is that gross income or is that the adjusted income?
That is gross income.
Also, just a reminder that I will send the slides out to those who registered for the webinar and that very short evaluation. And then I will let you all know when the recording is available online in case you'd like to share it with your coworkers who maybe were not able to attend today. Any further questions? Okay, well, thank you again to all of the presenters. That was a great deal of information, and hopefully those of you who are attending can use that information for your patients or your employees or other individuals in the community. Have a great day, everyone.